Thank you everyone for coming to tonight's webinar on Beyond the City, Exploring the Future of Rural Dentistry. We'll start with the agenda. Tonight we have two rural PA dentists, Dr. Marissa Wagehoft and Dr. Andrew Trin. They are going to talk to you about practice opportunity and career growth, financial advantages, lifestyle benefits, and then their personal experience with living in a rural area. And then Dr. Larry Morrow, who is the program director of University of Pittsburgh's GPR Rural Expansion Program. He's going to touch on a couple differences between the rural program and urban programs, training details, some stats, the purpose of the expansion, benefits, and a loan repayment program as well. We can go ahead and get started then with the practice opportunity and career growth.
Hi, I'm Dr. Wagehoft. I work in Elk County. I work in an FQHC, Federally Qualified Health Center, and we're the only FQHC in all three surrounding counties. So we get a lot of patients from very far away. Um, in in rural PA, there's far fewer dentists serving in rural communities, and so your patient base is just massive. Nearly 26% of Pennsylvanians live in rural communities or counties, yet only about 6% of Pennsylvania dentists practice there. In the next town over from us, we have two dentists who are a lot older, and so people will have to find new dental providers after that once they retire in a few years. So you can build a patient base much more quickly. You see them in the community. You see all of your patients there. Many rural counties have dentist shortages. Fewer than 15 practicing dentists. In my town, in the next town over, we only have 3 practicing dentists. So less competition for corporate dentistry as well. I think we have an Aspen 30 minutes south of us, but that's really the only corporate dentistry we have. So go ahead.
So, practice opportunity and career growth. Let me tell you, there is a much greater opportunity to purchase an existing practice. Uh, I'm your case in point here. Pennsylvania's dental workforce is aging, particularly outside urban areas, creating opportunities for ownership as dentists retire. I think so. A little bit of background on me. I graduated from dental school back in 2023. And when I moved up to Pennsylvania, within the past several years, then, like I think 5 of my colleagues had retired without successors. So the demand for the next generation of dentists definitely exists in the private sector as well. Um, you can become a trusted community provider. In many rural towns, dentists are among the small number of healthcare professionals and often become highly visible community leaders. The amount of people who recognize me between church and grocery shopping is kind of crazy. Um, especially as a urban guy myself, and there is the opportunity to have a more comprehensive clinical experience. Rural dentists frequently perform a wider variety of procedures because there are fewer specialists nearby. I don't know about you, Dr. Wagehoft, but uh, as far as I'm aware, there are no prosthodontists out here in the middle of the state. So, guess who's doing fixed hybrids?
All right, there are a lot of financial advantages to practicing in a more remote area in rural. So loan repayment assistance is available. Pennsylvania is really cool in the state of Pennsylvania. If you can't get a national health scholarship program, you can try for Pennsylvania's scholarship program. And so it's $80,000. You have to work full time and there are stipulations, but that is a great alternative. I know dental school loans are massive, especially this day and age. So it's always good, especially because most of Pennsylvania qualifies for healthcare shortage areas just because the age of the dentists are all retiring. And so there is a large need for dentists in Pennsylvania in general. If you work part-time, then they give 40,000 with those stipulations as well. Currently, I'm in the National Health Service Corps scholarship program. And so it was a minimum of 2 years you have to serve in a rural area, right? A place, a federally qualified health center, usually. And so they paid for 2 years of my school tuition. They paid for all of my instruments the very first year. They gave me a stipend. It was amazing. And now I only have half of the tuition left. And then you make a really good salary out here as well. Um, and you can own a home. Most people do own homes. It is a little difficult to find an apartment just because everyone just owns homes here. And then lower housing cost. My friends that practice in Chicago, their housing is massive. And so the lower housing cost is really nice here. Low overall cost of living. What I think is really cool in rural Pennsylvania is you get some more natural food, right? And so there is like we have a local butcher who does that, and there are a lot of like honor system things. And so whoever is like growing vegetables, they will just put it on the side of the road and they'll have a coffee can full of money. And so you just put your money in the coffee can and you take your vegetables, and it's nicer than a Whole Foods, because it comes right from there. Practice ownership can be more attainable just because it is the facility costs are much lower and all of that.
So lifestyle benefits. This is a big one. Shorter commutes. Uh, Back home growing up in the outskirts of DC, I mean, I regularly had to drive an hour to get anywhere. Now, I only drive 10 minutes to get to work. Um, More access to outdoor recreation. Rural Pennsylvania offers direct access to state forests, hunting, fishing, hiking, skiing, biking, and camping. Uh, I pass by Rothrock State Forest on the way to work every single day. More living space for your dollar. Rural homeowners often have larger lots, acreage, or homes than similarly priced urban properties. Less traffic and congestion. Reduced traffic means more personal time and less daily stress. That is absolutely the case out here in State College, and that goes double when the students are gone. So, uh, stronger community connections. Smaller communities often foster closer relationships with patients and neighbors, leading to higher patient loyalty. That is definitely the case. I not I alluded to this earlier. The amount of time that I actually spend with my patients is actually more than just the chair time. I get to make and foster these connections um, through these community events. Like right now, out in Boalsburg, which is just outside of State College, there's a big arts fest, People's Choice, and I expect to run into a whole lot of vendors there who are also patients. And last but not least, a slower pace of life. Many rural practitioners cite improved work-life balance and reduced burnout compared with their major metropolitan counterparts. And again, living testimony for that. So. The urban dentist, on average, has a higher average income uh, with higher housing costs, with more dentists competing for the same patient population, and of course, more traffic and longer commutes. By contrast, the rural dentist typically has a lower cost of living, housing costs, greater opportunity for practice ownership, larger patient demand, stronger community connections, easier access to Pennsylvania's outdoor recreation. And to put this in perspective, rural Pennsylvania has a dentist for every 2,001 residents compared to, I mean, almost what, 40% less? One dentist for every 1,267 residents in urban areas. Uh, that is a lot. Almost 60% more potential patients per dentist in rural communities. The idea of advertising is something that is pretty foreign to me because every day there is usually one, two patients calling to see if they can come in and get get established as a new patient. Um, and that would just not be the case if I had stuck around in any major metro. Um, and going through the chart, it kind of just lists out um, everything that we just talked about.
Okay, we're gonna go over our dentist's personal experience. So I'm gonna ask them each question, and then Dr. Tran, since your camera's up, you can answer each question first, and then Dr. Wechoft, you can follow. So if you want to start with your, I think you already went over location and practice type. So let's jump right into why did you choose to live rurally?
Oh, that's easy. It's quality of life. Um, Being so close to what I enjoy most, outdoor recreation, and also being able to not live my life in a car are two of the biggest reasons. Um, uh, at least from that perspective, uh, being being able to enjoy the natural beauty and having time to get everything else done outside of the practice is something that's invaluable. Um, but an even bigger, frankly, more important calling that I experienced was that there's a lot of people who are going to need help. And just like Dr. Wachoff had mentioned herself, a lot of these dentists uh, are just not going to be able to work all the way to and through um, their 80s, 90s, and whatnot. Uh, there is a demand for a younger set of hands to take care of them. Um, and so, the moving on to the next question, the thing that has surprised me most about rural practice compared to what I expected in dental school it was just the sheer volume of opportunity. Yes, finances are humming fine and well, uh, but perfect example. So many of the oral surgeons in our area take months. Do you agree with that, Dr. Wagehoff? Yeah, yeah. So, my ability to pluck, shuck, and chuck, same day, be done in 10, 15 minutes is something that I can provide to the patients. And so nobody's going to have to wait for weeks with a tennis ball sized infection on their cheek. Um, and so that was being able to serve in that way was a beautiful surprise. Um, oh, what I enjoy most about living in my community outside of dentistry, it just has to be the community. I mean, I go to Church at Calvary. The community that I've built there has been beautiful. And the amenities and proximity to everything uh, feeding into that better quality of life is in some what kind of elevates, you know, my gratitude to the man upstairs for ending up in this situation. And what activities or hobbies do I enjoy that are unique to living in a rural area? Um, Kind of alluded to this already. It's specifically cycling. The ability to ride mountain, gravel, and yes, some road is something that I was not able to do back home around DC. I would always have to commute an hour plus in order to do what I love, and that was not something I wanted to carry out through my now 20s, then 30s, 40s, 50s, 60s. That's a lot of time in the car. Uh, and as you can probably tell, rural living has made my work-life balance a lot better. Yeah, I run my own practice now, and I could not imagine having to sit through a concrete jungle every single day after work. And so, even though I spend a ton of time keeping everything running here, uh, it's just so much better than if I were anywhere else. And What advice I would give to someone who is hesitant about moving to a rural area? Um, it's really simple. You have to figure out in life where your priorities are, um, where they are, and in what order. Because it is very true. Uh, no, as much as I love practicing in rural PA, the reality is that there is no such thing as a perfect solution. I mean, you guys are going to get used to telling your patients this, believe you me. But all the pros that I listed have to be balanced with the fact that I'm now 4 hours away from home. Um, the if you don't enjoy these outdoor activities, let's say you're a city slicker, you have to be near the nearest possible, I don't know, altered state or something. This isn't going to be the place for that. Um, this is going to appeal to the outdoorsman, and having that realization in mind is important. Not just for the short term, but for the longevity of your career. Because, God willing, we're all on this earth for at least another half century or something. Um, so, and then the last question for a graduating dental student deciding between an urban, suburban, and rural opportunity, what's the one factor that they should consider most? Oh, whoops, I already answered it. So, yeah, there you go. Figuring out what matters most to you.
All right, Dr. Wagehoft, it's your turn. So we'll start with why did you choose to live rurally?
Yeah, I come from a small town in Illinois. So it's pretty similar. We just have rolling hills here instead of flat cornfields. And so I looked at this opportunity. I came to see the facility, and I looked out the window. There's a huge window in one of our operatories, and I saw chickens in the backyard just roaming around. And I was like, yes, I have to be here. This is the place for me. I also like to be known in my community. I like to our neighbors have a party every Wednesday in their garage where it's just like the town. Our town is 56 people right now. And so it's really good to just know people. People have your backs here. You can be in a big city, and my friend is in Chicago, and she doesn't even know her roommates, or not her roommates, but the tenants next door to her. And so just knowing your neighbors, if you have a problem in your town or in your house, they're there to help you. And so I've learned that about Pennsylvanians. They're hard workers, they're always there to help you, and they're just really good people. And so that's why I like to live rurally. It also worked for our schedule. So I have a husband, he works all remote. And so the the internet is really good here. They did that in Pennsylvania. They've run a lot of like fiber lines. And so, internet in a town of 56 people, they invested in the internet because they know people want to come back and work from home because they just don't have like the jobs that would be needed there, right? And so, it worked for us. It was perfect. That's why I'm here, right? And so, what surprised me the most, just the openness of the people. They're all so kind. I come from Illinois, and so I was like, oh gosh, like, is this still considered the Midwest? I don't know what about these people, but everyone has been so kind to us. So it's really, we can call it home now. Um, what surprised me the most? Yeah, so I graduated last year. They put me in a place, and now I'm booked 6 months out. And so the opportunity that I get, like Dr. Tran was saying, with the amount of things you're getting really fast extractions. You're getting really good at surgical extractions, which a lot of my friends that went straight into private practice in like the big cities, they're seeing probably 6 patients a day. And they're not getting the good cases, right? That the other practicing dentist would have in those operatories, right? They're getting just the fillings. And you need to be good at fillings, right? But I do multiple fillings a day. I do multiple extractions a day. I've did incisal and drainage. And so all of these things I would have never imagined I would have been able to do if I went straight to a private practice. And so, like Dr. Tran was saying too, we don't have a lot of specialists here, unfortunately. And so we are getting to do a lot of things, and everyone is just so grateful for the services that you're providing. And so that's also nice too, because in the big city, there's a lot of competition. And when you're just starting out, you're not going to be as marvelous as you probably think you're going to be. And so there's always room for improvement, right? But just getting the reps in is so important when you're just coming out of dental school. And you definitely get the reps in. I'm seeing 3 times as many patients as the people that are going straight into the private practice. What activities or hobbies? I learned in Pennsylvania, I don't know about anywhere else in Pennsylvania, but like central Pennsylvania, people have houses and they have camps. And so in the summer, they go to their camp. And that's like a different little house in the woods. And they just enjoy the little house in the woods. And so we've been to a couple and they're just cool, you know? And so we've never had that before. That's just something cool about here. People are always so friendly. So they're like, oh, you want to come hunt with us? You want to go fishing? People ice fish here. And so we just learned all these fun things. Rural living affects your work-life balance. It's been great. We go on walks. We take a different hike every weekend. And so we're really enjoying that. We're going to go to the Pennsylvania Grand Canyon this weekend. So that'll be really pretty. Advice you would give to someone who's hesitant, just try it. I mean, you can do it for a year, you can do it for 2. If you like it, stay. If you don't, then now you know, and you haven't missed that opportunity. For graduating to, yeah, like I said, just try it out and see. If it's not for you, then it's not for you. But at least you're not wondering.
Alrighty, we have finished the rural dentist part of the presentation, and now we can jump into Dr. Morrow's for the rural expansion program with PET.
Thank you, Amanda. I am going to try to share my screen. We were having some technical difficulties earlier, but let's see if we can get it to work here. How's that?
Perfect.
Was I successful?
Yes.
All right. All right, so let me hit OK here. And oh, okay. Well, let's jump right in. I hit the wrong button. So I really can't see what's on the screen except bits and pieces of it. So I'm going to do my best here. I was having technical difficulties. I don't want to screw anything up here, but like Amanda said earlier, first of all, thank you, Dr. Tran. Thank you, Dr. Wachoff, for your insight on rural dentistry. You know, I'm speaking as someone who's new to rural dentistry. I've been a private practitioner for 20 some years. Recently had private practice in suburban areas, although I did start my career in rural Vermont, which I love. Family and everything brought us back to Pittsburgh. So we're in suburban areas. I had a practice, very successful practice. I had a chance to work with multiple associates and kind of mentor them and help them along and have worry about, the 15 dentists who are across the street from me and market so I can get patients in my door instead of theirs. So there are all of these challenges that a lot of docs have in urban and suburban practices are real. I used to set a budget for myself of 2.5, 3% of revenue of expenses. I mean, advertising expenses to revenues would go towards advertising. And do the math. If you're doing $1 million or more, that's a significant amount of money that you're losing, you're wasting. So there definitely is something to be said about rural dentistry. One of my good friends, who was an associate of mine, I was actually a faculty of his probably 15 years ago when I first got back to Pittsburgh and I was in the dental school for a little bit. He was an associate of mine for about 5 years, and he decided he wanted to practice in rural dentistry. He wanted to practice rural dentistry. So he left practice, and he has a very successful practice, probably an hour, maybe an hour and a half north of Pittsburgh in a rural community. And he is just living life. I mean, he's a big Swiftie. He has 2 kids. He has a wife. He's goes across the pond to concerts all the time. Taylor Swift concerts, Foo Fighter concerts. He's Steeler games in Ireland. I mean, he's just living his best life, and he loves it. He would never go back to urban or suburban practices. So I had an opportunity after I sold my practices to take on another challenge, and that was to be the program director of our GPR programs at the University of Pittsburgh. So I've always kind of been part time on the clinic floors, and this opportunity came uh, for a vision that our dean had to expand the access of the dental care access to Pennsylvanians. There's a real big crisis, obviously, going on, and as a lot of the slides alluded to, rural areas are being hit the hardest. A lot of people in some of these areas have a 2-year wait before they can actually get in to see a dentist. So it's pretty sad. Some people have to travel hours to get to a dentist who can actually see them. So our plan, Dean Oakley, Dr. Oakley's plan, was to address this workforce gap. As Dr. Tran said, a lot of dentists are retiring and they are just walking away from their practices because they have nobody to jump in and take over and help see these patients. So there's rural providers are leaving 2 times as fast as non-rural providers. So there's really this huge gap, and what it's created is 153 dental health profession shortage areas throughout the state of Pennsylvania. And so what we are doing is we are addressing those needs, and with a solution that will allow us to bring what we're calling regional training centers to these dental health profession shortage areas. What these regional training centers are going to do is we're going to bring our 3 GPR residents to each center, 5 hygiene students to each center, and 12 dental assistant students to each center. So we're bringing the care where the care is needed. And it's going to allow us to see thousands and thousands of patients each year. Currently, we've successfully opened up our first 2. They just started this past week. What's today? The 9th, July 1st. So a little over a week ago, in Titusville and Bradford, PA. So Titusville is about an hour north, about an hour. I take that back, about an hour and a half north of Pittsburgh. So we're over on the western side of the state. Bradford is about 3 hours northeast of Pittsburgh, close to the New York border, not too far from Olean, New York. And so those are our first 2 that we opened, our first 2 regional centers that we opened this year. We also have our program at Pitt. That's the mothership, so to speak. Next year in 27, we are also opening a regional training center in Johnstown, which is about an hour east of Pittsburgh. And so we're strategically identifying these areas that are in the highest need. So Bradford, for instance, where our regional training center opened, it's in McKean County. There are 11 dentists in the entire county of McKean. And just for reference, in Allegheny County, where Pittsburgh is, where I practiced for all these years, we have over 800 dentists in the county. So there's a lot of competition here in Pittsburgh, and you don't have that in rural areas. We're all fighting for the same patients. Respectfully, we don't really fight. But how this works is for these regional training centers to work. There's actually 3 partners that are involved. There's ourselves at the university. We provide all the recruitment of the students, of the residents, hygiene students, assisting students, residents. We're responsible for recruiting faculty to be at each of these locations. Everything that has to do with CODA, they all have to, we all have to be accredited. The curriculum design, everything that goes into running one of these programs, that comes from our side. We also have to locate a dental center. So the majority of them would be federally qualified health centers, FQHCs, or FQHC lookalike, something similar to that. Their responsibility is going to be staffing the dental center. They're running the dental center. They're providing the supplies, they're providing the equipment. They get all of the revenue from what our GPR residents produce, what our faculty dentist produces, what the hygiene students produce. So there's a monetary benefit as well for them. And then we also have a hospital partner, because the GPR program has to have a graduate medical education portion of the program. So we have to work with regional hospitals as well. And that's really nice, because the regional hospitals oftentimes get inundated with dental calls and oral health emergencies. They really don't know what to do. They really don't know where to send them. So now that we have a partnership with them, our residents can be on call. So we still get that medical experience that you would get in a GPR program in a urban center. We also have to participate in the rotations on the medical side: an anesthesia rotation, an ED rotation, an emergency internal medicine rotation. All of those rotations that you would have to perform at any other GPR program, we still have to perform those at our regional training center. So what that looks like now, where we are right now, we have 9 residents. We have 3 in Bradford, 3 in Titusville, 3 in Oakland, or Pittsburgh. Next year, we're adding Johnstown to the site. We are also in talks with probably 4 or 5 other partners across the state of Pennsylvania, not just in Western PA, even moving out east a little bit, in order to bring this model to some of these communities again that are in need to help with access to care crises. So our goal is to really have about 10 to 15 of these by 2030, 2032. We'll kind of see how that plays out. But what makes these programs great for the residents is that, as Dr. Wachoff and Dr. Tran said, there's such a high patient volume. You're getting to do an enormous amount of procedures on patients that our residents in our PIT program, it's a great program. I'm not knocking it. That's my program too. But we are still in a dental school setting, and we still are in Allegheny County, which has a lot of dentists, and we are still in an institution where we have grad prost, we have oral surgery residents, we have grad endo, we have grad perio, we have 160 dental students across 3rd and 4th year who are all trying to fight for patients to get these experiences that we want to get. So it is a little more complicated in the program at the university to get some of these more advanced experiences. And we've made some changes to really make sure that we get these experiences, but the rural centers, they just come. I mean, they're just there. Bradford, we have a 400 patient wait list already, and it just opened. Like, it's crazy. And we have some great clinical site directors that we've hired who are considered boots on the ground, so to speak. So they are there. They are what we consider super GPs, like Dr. Tran had mentioned, and Dr. Wachoff had mentioned. They're doing procedures that they never would have imagined that they were doing, because when you're in an urban setting and you have 2 oral surgeons within a stone's throw of you and 6 endodontists, it's kind of easy to say, you know what, this is kind of challenging. I'm just going to send them over there. We'll let them deal with it. Where there, that's it. You're all that they have. So you really have an opportunity to do procedures that you never would have thought you would be able to do, and in a controlled environment where you have the support of a seasoned clinician who's right there to kind of walk you through it and to give you that confidence and that competence to be able to do these types of procedures. As Dr. Chan said, there's also a community immersion portion of this where we do want to get involved and integrated with the communities that we're helping to serve, whether that be oral cancer screenings at town fairs or going to elementary centers and doing exams on children. We really want to be part of the community. We wanted to earn their trust and earn their respect and let them know that, hey, we're here. We're the good guys. We don't have to suffer through generations upon generations of neglect anymore, because we're here to help you. We're here to take care of you. And that's really what it's all about. It's nice as well, because when we are recruiting our our hygiene students and our dental assisting students, we're really making a big push to recruit from these communities or these nearby communities because there's such a huge shortage of auxiliary staff. I mean, even in urban areas like where I am, suburban areas, it was always a struggle to find assistants and hygienists. So I can only imagine how challenging it is in the rural communities. So if we can really reach out to the and create awareness that hey, these programs exist and you could do these from your own town, maybe just maybe some of these students will graduate and stay and continue to practice. I mean, every community that we're opening up in, I have dentists calling me saying, "Hey, I'm first in line. They can have my practice when they're done, when they graduate, because there's just such a need up there." And well, I say up there because they're all north right now, but in these communities. So just for instance, I just kind of want to show you what this looks like a little bit. So this is our center in Titusville. Now, I always had a practice that was high on technology. I had all the toys. Fortunately, at the University of Pittsburgh, we also have all of these toys, and it's great to be able to practice the next generation of dentists, teach these next generation of dentists the technological advancements of where dentistry is now and where it's going. So the university is really big. They have a really big digital footprint, in the community, and we're really on the cutting edge. So when we decided that we were going to do these programs, I said, hey, I want this stuff in our programs. I want our residents to be able to learn on these pieces of equipment and understand how they work. So we have a great partnership with Dexis. We have a great partnership with SprintRay. So we're CBCTs, which are great for a lot of things. I'm sure you all know SprintRay 3D printers, intraoral scanners. These are all going to be part of our program as we continue to build these out. This is our Titusville location. It's almost near completion, so we're a few weeks away. So I don't have any really nice pictures of it yet, just our schematic drawing. But there's 10 operatories, so we have 3 operatories for the docs, for the GPR. They're kind of own little operatories over there. We have six operatories for overflow and hygiene, and then we have one that we will usually dedicate for surgery or endo or implants or something like that. So we really want to make it flow like a private practice. And in these regional training centers, that is going to be your easiest pathway to understanding what it's like to work in a private practice, because patients come in like they would in your private practice. You get to work with the hygienist and come up with a treatment plan and work with the patients and follow that patient through from start to finish. And so that's what's really nice about this type of a model here. And this just kind of follows up what we've already talked about. Our commitment at Pitt here to our community is to really address this access to care crisis that we're facing. We really want to develop the workforce, like I talked about, in these communities, and get these people to stay in these communities. There's a lot of studies out there that show that if where you train is where you stay. And so if we can train people from these communities in their communities, there's a good chance that they're going to stay and continue to thrive in these communities. And like I talked about, we want to continue to scale these sites, throughout the next 5-10 years. And that's about it. I will stop sharing my screen. And if anybody has any questions about anything, feel free. But I couldn't be a bigger advocate for rural dentistry, not just because I'm part of this program now, because my eyes have been opened to what is out there and what is happening, that I kind of knew living in Vermont for 5 years and practicing in Vermont, but I think I forgot about when I moved back to Pittsburgh. And now I've been reminded and I see it firsthand. And so it's really great what you guys are doing, Dr. Tran and Dr. Wagehoff. And so I appreciate you for what you're doing. So thank you. And I appreciate everybody for being here today.
Yeah, I want to thank all of our dentists for putting on a wonderful and very thorough presentation tonight. I feel like we covered rural PA very well and really highlighted some benefits to living rurally. Is there any questions that anybody has? You can type them in the chat and I'll read them out loud, or unmute as well. If you have any questions, go ahead. Okay, there is one so far. At each site, there are 3 residents. How many attendings or other practicing dentists are at each site, if any?
Yeah, thank you, Jillian. That's a great question. So There are 3 residents at each site. We have in so it varies. So in Titusville, we have one clinical site director who is boots on the ground every day there. We also have adjunct faculty members who are there. They sometimes see patients. They sometimes are preceptors or supervisors for our dentists. If our site director has to be out, everybody needs a vacation, everybody needs a break. It's about work-life balance. I will fill in, or our adjunct faculty member will fill in. In Titusville, we actually have 2 clinical site directors. One is there Monday through Thursday. The other one is Tuesday through Friday. They overlap and they both work with the residents on the other days. We also have a strong adjunct faculty, specialty faculty presence here at the university. And so, for instance, where I'm working with an implant company right now, and there actually is one of our adjunct faculty members at Pitt who works with our GPR program, is a clinical trainer for this implant company and the surgical placement of implants. And so what we are doing is we are bringing this system to these regional training centers to be able to provide an opportunity for our patients to receive an option of receiving implants for teeth that are missing, where we may otherwise have not have had that option because of the expense. And we've worked out some really great deals, and the company is really supportive of us to provide a lot of gift in hand implant components and implant parts to make the financial burden not as great, or pretty insignificant for some of these patients that might need that. So we have a lot of support as far as that's concerned. We have endodontist adjunct faculty members who maybe when there's a day when we come up one day a month, 2 days a month, when there's difficult root canals beyond the level of even what our super GP site directors can do. Because that happens. We still refer things out. There's still specialists out there to do these difficult procedures. And so we'll set up a day where that's all we do that day. That's all our residents do, or difficult endos under the guidance of a seasoned specialty clinician. Same goes with surgery. So there's definitely going to be a lot of support. My goal, I've been doing a lot of traveling lately, is I want to be at each site at least once a week. Now, there's only 5 days in a work week, and when we have more than 5 sites, that's going to change, obviously. But for now, I spend a day in Bradford, I spend a day at Pitt, I spend a day in Titusville, and then the other 2 days I typically work at Pitt again on admin stuff. But I like to be there. I like to be part of it. I like to be present. I feel like I have a lot to offer. One of the reasons why I took this position was to be able to um, provide a mentorship ability. That's what I enjoy. One of the things I enjoy the most in practice. Yes, I enjoyed seeing patients and doing that stuff, but I really enjoyed the connection I had in helping out younger docs. I think maybe that was kind of my little way of giving back. But yeah, you'll definitely have support in all of these sites, or it wouldn't work.
Any other questions? Okay, how prepared did each of you feel graduating from dental school and moving into a rural setting and taking on the complex cases given there are limited specialists nearby? Yeah, Dr. Waychoft, if you want to start.
Okay. Yeah, so we had quite a big patient population because I was close to St. Louis. I went to Southern Illinois University. So we did get to do a lot of things, but I felt very unprepared, right? Because they just stuck me in a place and they said, here are your patients. And I was like, oh my gosh, but you know so much. With dental school, it just comes back. And so if you have a patient that has an oral lesion and you remember that path lecture from that one time, you're like, oh my gosh, yes, I do know more than I think. So don't freak out when you graduate. You do know more. And there is always a referral option, right? It's just it takes a long time for them to get the referral. So you may have to give them an antibiotic and you may have to just kind of wait it out. But I didn't feel prepared to do that incise and drain. And so I told my company, I really need to go to some lectures, some CE courses for that. And they all expense paid. They're like, yes, go do that. And so I got to do that. And then I learned a lot. And then I've just used it like a couple weeks ago. And so if there's any deficiencies or whatever that you want to keep learning, usually they give you a pretty big CE bonus too when you practice rurally.
So I'll just build off what Dr. Wachoff was saying. Yeah, the big thing that I want to say is that the basics that you learn in school are the foundation for everything else to come. And admittedly, it may take a lot of creativity to apply it, but chances are you're already equipped better than you know.
I just want to add to that real quick. Now, I'm a lot older than everybody else on this panel here, so um, there have been
Nonsense.
times when I graduated dental school 20 some years ago, right? So there are times when I'm in a room with a patient and I'm talking to a patient and I say things to a patient and I walk out of the room and I look at my assistant. I said, "Where did that come from? What did I just say?" And then I think about it and it's like, oh my gosh, I'm picturing myself sitting in a lecture from years ago and having an instructor saying these same things to me. It's like the strangest thing. So like while you may not consciously think like, oh, I don't know anything, you really do.
Any other questions?
I had a quick question. I'm a dental student at Temple, and I'm not sure if I misunderstood it. I just a little information about me. I was born and raised in Egypt, and I always loved rural living. And I was asking one of my instructors about this, and she was mentioning something in lecture in dental public health course that in rural practicing in rural areas, there aren't a lot of incentives. You might struggle to pay off your student loans and it's not really about it's going there. It's just about you like living there and you like the area. Don't you? My biggest issue, my biggest question is that is it true that you might struggle with paying off your student loans and just kind of making ends meet if you get to practice in a rural area?
I can speak to that if I want. So I was thinking, oh my gosh, I have to work in a federally qualified health center. They've given me 2 years. I'm going to be paid nothing. But I'm actually being paid equal, if not more, than a lot of my classmates. And so they do, you just have to find your place, right? But you will be able to pay off your loans. Yeah.
So, well, I'll say this because I'm in the private practice setting. So, what I can tell you is that you have to be smart about your finances and you have to be smart about how you conduct yourself because the money is there, but if you're blowing it off on repairs you don't need or um, uh, being unwise with all the gifts you've been given, then you will struggle. But uh, I am 3 years now out of school, and I'm a lot of the way paid off of my student debt, and no special programs. It was just me and the Department of Education.
Yeah, that's great. I think actually it might in fact, it might be even the opposite of that. I think you have more opportunity for loan repayment when you're in rural areas than when you're in urban areas. And I can tell you as a practice owner in a suburban urban setting, you can produce $10 million a year, right? But if your expenses are 9,800,000, you're still going to have a $200,000 paycheck, right? So you could be in a rural area producing $10 million a year, but your expenses might be half of that, right? There's a lot more money you take home. So what that means, expenses are a lot higher in urban areas. Rent is significantly higher, first of all. Your employee salaries, which is always your biggest expense, is significantly higher, commands a significant higher rate than in rural dentistry. And advertising alone, that budget's gone in rural. You don't have an advertising budget anymore and when you're in rural dentistry because you're there, people come to see you, you form those relationships, you don't have to market yourself. um, if I had to do it all over again, I would have, well, okay, I would have came back to Pittsburgh because my family's here, but I would have gone into a rural area around Pittsburgh and done it there again if I had the opportunity.
Okay, we do have another question in the chat. While applying to a GPR program, can you apply to specific regional training center through a DIA pass?
Yeah, we have one program, one main program, University of Pittsburgh, whatever it's called, GPR program, and within that application, you have an option to list which training site you would prefer. Some we've have applicants right now who only want to come to Pitt. We have applicants who only want to go to Titusville. We have an applicant who only wants to go to Johnstown. So we take all of that into consideration. Some applicants say any regional training center, I just want to be in a rural area, and they'll just put the three that we have right now, rank those in order. And we work on a rolling admissions type of a basis. We don't participate with a match, but we do a dia pass. So it's kind of I'd say kind of a first come first serve basis. Last year we filled the spots by December. This year we've already started filling some spots already for this year. Well, I should say for 27. So I think part of it is because the pass opened earlier, but part of it is because we've created some much more awareness of what we're doing now than we did last year when we first came in. So yeah, you can apply to all of them, one of them, two of them, whatever you prefer.
They also asked if it was possible to observe for a day at one of the regional training centers.
Yeah, certainly. I mean, that's always an opportunity. I mean, if you have my email address, maybe you can pass it along to whomever if they had a question about that. That would certainly be doable. Yeah.
I will include it in the post-event email. A lot of you do know I send them with the survey as well. So I'll include Dr. Morrow's email so you can reach out to him. So just keep an eye out for that. Are there any other questions?
All right, yeah, one last question. How would I find out what qualifies as a rural area? Because at Temple Dental, they're doing a program. There's I think they're building a clinic in Tamaqua, in PA. And I found a website that actually classifies what are the underserved areas in every state, and like none of the areas that show up in Pennsylvania are considered underserved or rural, or I'm not sure. How do you find out which areas are rural, which areas are underserved?
There's a if you go to you could probably Google it and find the URL. I'm not sure what it is. It's a Pennsylvania Coalition of Oral Health, PCOH. Yeah, Pennsylvania Coalition of Oral Health. There are different links on there that you can break down county by county. You can look at, I mean, the statistics on there are just ridiculous. And you can see where a lot of the data that I got in my slides comes pretty much straight from there. I stole one of their slides. I referenced it though, but I stole one of their slides anyway, the map. Um, but yeah, I think that website has everything. I mean, it breaks down by number of dentists in the area, Medicare, Medicaid, breaks down hygienists in the area, staffing I mean, it's just everything, and it shows you everything you need to know: population, dentist to population ratio, what's considered a dental health profession shortage area. So I check that out as a first resource, and they also probably have links to other resources on there as well.
If I may chime in, um, something I do want to say would be a very valuable resource among those of you who are at all interested or curious in private practice. The American Dental Association has a service called Practice Transitions, and that's actually what I used to find this practice out in State College. Um, so, long story short, it's senior year dental school. I know I want to own a practice. Don't know where across these 50 states I'm going to do it. I cast the biggest net that I could with ADA practice transitions. And after talking with folks out in Maine, New Hampshire, golly, Wisconsin, and a ton in Pennsylvania, that I was able to narrow down what I wanted out of each practice, the types of insurances accepted by the practice, staffing, procedure makeup, and I was able to interview and really get to know over maybe 2 dozen practices before I finally ended up out here in State College. So the resources are out there and they exist, depending on whatever you want uh, to guide your career.
I will say too, on PDA's website, padental.org, we do have a career board. So you can find postings from rural areas as well when they're looking for an associate or someone to buy their practice. So we definitely have postings as well that you can take a look at if working in rural PA interests you. And are there any other questions? Okay, seems like we might be done with questions for the night. I want to thank everyone for coming tonight, and I want to thank Dr. Morrow, Dr. Tran, and Dr. Wachoff again for putting on a wonderful presentation. You guys all did an amazing job, and I hope everyone learned a lot and all their questions are answered. As always, there will be a post-event email with the recording and survey that you'll receive an Amazon gift card for completion. And with that, thank you again, and I hope everyone has a wonderful night.
Thank you, guys.
Thank you.
Thanks everybody for their time. It's been wonderful.
Thank you. Bye-bye.